And it's because these lumbar disc herniation symptoms, they come on hard and fast. You need to be aware of them. And that's what this video is about, is to show you and tell you, to give you ideas of what the early signs, those first early signs of lumbar disc herniations are, so you know what to do if and when they occur to you. Hey there, it's Dr. Walter Slubro. I'm a chiropractor in Vaughan, Ontario, Canada. And what my channel and my office is about is helping people recover from chronic spinal conditions like disc bulges, leg pain, numbness, tingling, sciatica, scoliosis, chronic spinal degenerative conditions, so they can overcome this pain and then live a better life, better quality of health. And in this video, I'm going to outline some of the early first signs of lumbar disc herniations that I've seen in my patients to give you an idea of what to expect, just in case it's something that may be happening to you, and what you should do, your first immediate steps that you should do to get help and get this handled properly. There are three particular symptoms that I'm looking for in my patients when they come to me for the very first time that may point towards a lumbar disc herniation, these early symptoms. Number one, if a patient comes in and they can hardly move, they have very restricted mobility, they're really dragging themselves as they're moving. Like I had this one man that he came in through the front door and he was holding on to our counter space at the front desk, holding on to the walls to walk into the office for support. That to me already is an early sign of a lumbar disc herniation, and we confirmed it with our examination and of course with further imaging studies. Another thing that can be an early sign of lumbar disc herniation is if there's immediate onset of shooting pain down the leg, or tingling numbness down the leg, or severe leg pain that goes down into the calf, into the foot, into the toes, and it came on instantly, suddenly. That to me is an early indication of possible lumbar disc herniation. And then the last thing I'm looking for, and this I see very, very often, is a very serious shift in posture, a very drastic lateral shift in posture. So that's called an antalgic posture. Had this one gentleman that came in and he's walking with his whole body, his torso shifted to the side, crooked. And the reason why that happens is the brain, the nervous system innately wants to move away from that inflamed disc injury into an antalgic. Antalgic means not painful or against pain or something that's away from pain, antalgic. Okay, so they're moving away from that pain position into the relief position. That's called an antalgic posture. That to me is an indication possibly of a lumbar disc herniation. So those three symptoms, which we'll review now in a moment, most often they correlate to lumbar disc herniations. So what are they again? It's a serious restriction and limitation in mobility, okay, moving around. Number two, it's a sudden onset of leg pain into the calf, foot, and toes. Number three, that drastic distortion of posture, shifting to one side and stuck like that in that antalgic position. Most often these are very early first signs of lumbar disc herniations. Now, what should happen? At my office, my philosophy, my belief is that surgery should be the last resort, and we want to try to correct these structural distortions that are irritating that disc, inflaming that disc, causing that pain and lack of mobility and loss of function. We want to correct the underlying spinal distortions that could be irritating that disc. So we have corrective methods that we do in our office. We apply corrective chiropractic methods, chiropractic adjustments, postural corrections, tractioning of the spine to improve that alignment and relieve the abnormal loads on that injured disc and give it a chance to heal. So that's our method, is applying corrective techniques to get that body and the spine to heal properly into proper position, and in the end avoiding the onslaught of drugs and the possibility of surgery, because we want our patients to avoid surgeries, and guess what? Our patients want that too. So it's always a last resort, right? And remember this, an optimal spine equals optimal health. It's super important to have a healthy, strong spine and back because it correlates to health outcomes in the future. So do keep these symptoms in mind. In case that's you, do get it checked immediately by your medical doctor or your chiropractor or a chiropractor, and then be sure to do some kind of assessment of spine and posture with a corrective care chiropractor, and then determine what kind of corrective care methods you need to alleviate the pain and restore that spinal alignment, spinal function, so you too can live a proper good life and do the things you want to do that's important to you, and of course avoid onslaught of taking drugs and avoid surgery. The most positive favorable outcomes I've seen in my patients that have had confirmed lumbar disc herniations, whether it's L4, L5 disc bulge or L5S1 disc bulge, are the people that came in at the early onset of these symptoms. Had this gentleman once that came in and he was perfectly fine in the morning, and in the afternoon he couldn't walk. He had this pain that went right down into his leg, into his foot, and he was shifted over to this posture, just like I talked about earlier. One of our differential diagnoses in his clinical assessment was a possible L4 and L5 disc bulge, and it was confirmed on his MRI as well. And he recovered really well within 3 months. No more pain, walking normally, upright posture, living his life completely normally, because he came in and got it assessed early at the early onset of these symptoms and got it corrected. I've had patients that have come to me 2-3 years after the early onset of these symptoms, and they just are having trouble recovering fast like this other gentleman because they waited too long. So the key thing for you is to get this assessed immediately by your doctor, get in with a corrective care chiropractor and start getting this corrected so you can also recover quickly and as well avoid that surgery, all right? Now, the other thing I want to share with you is the anatomy behind a disc bulge, the tissues that are involved, give you some images and also some stretches and exercises that may help alleviate disc bulge. So be sure that you go to this video right over here, right now. Go to this video right here to catch that tutorial and then check out these great exercises for L4, L5 disc bulge, L5S1 disc bulge. Watch it right here, right now.